Okay, thank you very much. The two collaborating centers under my responsibility are two centers in Brazil, the Instituto Lauro de Souza Lima in Bauru, in the state of Sao Paulo, and the Fundación Alfredo Amata, FUAM, FUAM, in Manaus, also in Brazil. Both of them work on leprosy. So during the last 2 years, and in fact, more broadly speaking, they have been supporting the PAHO's leprosy program in order to contribute to strengthen the country's capacities for the for the leprosy programs, for the control, prevention, treatment, management of leprosy and its complications, also for the public health surveillance, etc. That's generally speaking. More specifically, both training centers have provided, for example, both collaborating centers, sorry, have provided training for some of the professionals in Latin America and the Caribbean. Last year in 2020, because of the COVID pandemic, we couldn't do in-person training, so we did 4 or 5 webinars on different aspects with the two collaborating centers. They are also, one of them particularly, the Instituto Lauro de Souza Lima, has been very actively participating in the monitoring the resistance of Mycobacterium leprae, the bacteria that causes leprosy, to the drugs that are being used for treating the disease, and they sometimes have contributed also to provide some advice, for example, on different aspects. Recently, for example, they participated in a conference call that we had on the issue of safe use of thalidomide for the management of leprosy reactions, and we are drafting a document on that. So that has basically those have basically been the activities in the last 2 years, I would say. Well, the impact is that, of course, we have more capacity at the national level of the leprosy programs, and we expect that to be reflected also to have an impact on the subnational levels, state and municipalities, etc. Further down towards the primary healthcare level. That's something that we haven't really, let's say, assessed, but that is something that we expect, and that eventually that will be reflected in in an increase in the number of new cases detected, in an improved treatment and management of patients with leprosy, and in an earlier detection of patients with complications and better management of the complications of leprosy. So we could that is something that we haven't measured so far, but we do expect that in the future, near future, we would have, for example, the number of new cases detected to increase in several countries. Yes.